Hello again, everybody. For our week 3 discussion, when thinking about determinants of health regarding tobacco prevention control, I focus first on our textbook reading and the lecture for this week. Schneider, who's our textbook author, discusses the importance of going beyond education and regulation due to how complex an issue such as tobacco can be. There's already ample education provided to individuals regarding the negative effects smoking has on health. There's also ample regulations regarding negative effects on individuals under the age of 18. However, according to the CDC's website, nearly 9 out of 10 cigarette smokers first tried smoking by the age of 18, and 99% first tried smoking by the age of 26. So the regulation laws are clearly only but so effective. An article I found that's entitled Addressing the Social Determinants of Health to Reduce Tobacco-Related Disparities places an emphasis on the lack of focus on lower socioeconomic groups. I think that this assertion has been a theme throughout our weeks thus far, that individuals of a lower socioeconomic group overall lead unhealthier lives for many factors. This is also true, though, when it comes to tobacco use. Additionally, the article I referred to reviews that low SES interacts with a variety of other factors, including race, acculturation, marginalization, such as being gay or bisexual, mental health issues, and stress. And additionally, the article looks at interesting ideas around some political changes that could be made to impact tobacco. The authors state that low SES individuals are not as likely to work in places with smoke-free policies as individuals of higher SES are, and they're not likely to live in communities where smoke-free laws are prioritized, thereby enforcing a community of smokers. As we learned in our textbook, one large factor in the continuation of unhealthy behaviors is the idea that everyone around you is doing it, and that it's a widely accepted behavior. The article also supports the idea that more education that aims directly at low SES communities, tobacco price increases, and more comprehensive smoke-free laws are needed. However, I want to focus on a factor in the article mentioned being kind of one of those factors in low SES communities, and that is mental health issues. Just to be clear, mental health affects all populations, but often individuals in low SES areas have limited access to quality mental health care services. And I want to focus on how mental health may be a social determinant in tobacco and prevention control. I was able to find an empirical study that may show a link between depressive symptoms and smoking in a forensic population, and I've cited that article in my transcript. The study was conducted on the inmate population that had a sample size of 353, and the author asserts that depression was an independent factor when it came to predicting tobacco use in that population. Additionally, that same study referenced a different study that was done on the general population that was making a similar assertion around depression and tobacco use. Granted, focusing in on such a specific group of individuals, men with depression in these two studies, may not have a huge impact when it comes to a large public health study or a recommendation for implementation. However, this direct correlation can help increase the effectiveness of existing education and prevention because males with depression may not be able to make the decision to stop smoking in the same way an otherwise healthy adult can. I would need to do more research in order to make a hypothesis around what education or policy may impact the mental health population. But I thought it was important to highlight this example because it demonstrates that education for all does not necessarily mean it is effective in impacting the health in all communities. And that, of course, relates to my focus for public health. So I look forward to hearing your guys' feedback and any questions or thoughts you may have that could really help me dig deeper into these types of issues and formulate thoughts in a more complete way. So I look forward to hearing from you. Thanks.